All this is Dr. Mubin Sayed from Drbeen.com. Welcome to one more show. There were so many things that needed to be looked at. There is so much development, important development from Cool Beans' point of view. The questions that I've been getting: number one, what are the updates on Novavax? So you'll be happy to hear that Novavax's uh, trial participants have been declared fully vaccinated by, I believe, FDA. So that's a good news. And then we'll talk about what does that mean for the Novavax to come out in the market. We'll also talk about the menstrual irregularities and what NIH is doing about it. We'll talk about Israel and the fourth booster shot, and we'll talk about a bunch of other news as well, including Vermont's policy for ivermectin, which one of the patrons shared with me. So I hope you're doing well. Let's start this discussion. Tomorrow we'll do a Zoom call. I was thinking of doing that today, but I thought this understanding this news and being on the same page, you are mostly aware of these. I had not been looking at them, so I thought we'll become on the same page and then we'll start. Hey, Jana, how are you? Long time no see. So let's start our discussion. So, love for all, and here is the references first. And today we'll actually go with the references as well and just look at the news here. So, first of all, this is Dr. Bean on Odyssey. So, on Odyssey, Dr. Mubin Sayed, let me move my window a little below the reference links. So, give me 1 second, please. Um, it looks odd over here, but it allows us. How about I move it down here for today and we'll go from there. Sorry about this, and we can now continue. So this is the Odyssey, drbeen.com, or not drbeen.com. This is Dr. Mubin on Odyssey. Here is the first news. Item of interest: NIH funds studies to assess potential effects of COVID-19 vaccination on menstruation. This is something that Cool Beans have been discussing for a long time. I have discussed what may be the potential mechanism. And good news is that NIH is now funding the studies to try to figure out if there is a relationship. And if there is, which I think there is, then what is that relationship? What causes it? And what is the hopefully remedies for it? So if you see here, the National Institute of Health has awarded 1 year supplemental grants totaling 1.67 million to 5 institutions to explore potential links between COVID-19 vaccination and menstrual changes. Now, what are they doing? The new awards support research to determine whether such changes may be linked to COVID-19 vaccination itself and how long the changes last. Researchers also will seek to clarify the mechanism underlying potential vaccine related menstrual changes. So they'll try to figure out what is the mechanism. One, is there a link? And number two, what is the mechanism? Then they say here other factors that may cause menstrual changes include pandemic related stress. So, what are the possible factors? Pandemic related stress. Any stress can do that. In men, it affects libido, even semen volume can reduce. Sometimes ejaculation just disappears altogether. In women, menstrual irregularities are common with the stress. Lifestyle changes related to the pandemic and infection with SARS-CoV-2, the virus that causes COVID-19. So these are some of the possibilities. The question is, what is the relationship to the vaccine? Researchers will assess the prevalence and severity of post-vaccination changes to menstrual characteristics, including flow, cycle length, pain, and other symptoms. And we have been discussing this, that there are some women who experience heavier than normal flow, some experience lesser flow, and some just have irregularities that for months there are no periods. So that is the news for. So if you see here, several projects also seek to unravel the mechanism underlying the potential effects of COVID-19 vaccines on the menstrual cycle by examining immune and humoral hormonal characteristics in blood, tissue, and saliva samples. So this is interesting news, and I think this is important as well. Then the second part of the news that once again all of us are aware of, and I wanted to be in the same page as well. FDA has authorized booster dose for Pfizer only. They say that this is only for the Pfizer, and the booster dose is also not for everyone. So today, the US Food and Drug Administration amended the emergency use authorization for the Pfizer BioNTech COVID-19 vaccine to allow for use of a single booster dose to be administered at least 6 months after completion of the primary series, 6 months after. Individuals, so or at least 6 months, individuals 65 years of age and older, individuals 18 through 64 years of age at high risk of COVID for comorbidities, for example, individuals 18 through 64 years of age with frequent institutional or occupational exposure, for example, healthcare workers. Now, the question that is in my mind is this something that is going to end up on vaccine passports as well? Are there going to be more vaccine passports? And number two, is this going to become part of that? For example, if I'm a healthcare worker, so I don't practice here, so I am kind of away from this kind of mandate, but a healthcare worker who is practicing in the US, and then it is said that, hey, there is a booster dose for you, and if they opt that I'm not taking it, will their vaccine passport be affected? Number one. And number two, I understand that there is a high exposure, so that can be taken as a risk factor. So we'll have to see how does this further unfold. They say that today's action demonstrates that science and currently available data continue to guide the FDA's decision making for COVID-19 vaccine. I also want to make sure that we can see here the FDA amended the EUA for the Pfizer BioNTech COVID-19 vaccine to allow for booster doses in certain populations: healthcare workers, teachers, daycare staff, grocery workers, homeless shelters, prisons, and so on. And they then talk about it that this is only for Pfizer and not for others. So this is one other news. We saw that they had actually rejected the booster dose for everyone, and they had objected about the booster dose. So here is a more selected group. If you are part of this group, so let's say age 65 and over, or somebody with the risk, or somebody exposed, how do you feel about it? What has been the communication with you? Okay, so continuing. This is an old news, 10 September, Australia banning ivermectin. I was working on the androgen series, and so I did not discuss this, but I think all of us know that Australia banned ivermectin's use. The reasons that they use are not very medical science type. They are mostly, for example, firstly, there are a number of significant public health risks associated with taking ivermectin in an attempt to prevent COVID-19 vaccine infection rather than getting vaccinated. So this actually is we have had these discussions, and it is actually clear if you look at the pharmacology books that the safety profile for ivermectin is pretty good. Here, what they did was they conflated the two messages here: significant public health risk associated with taking ivermectin in an attempt to prevent infection rather than getting vaccinated. So they kind of are opening up here and saying that, hey, if ivermectin is your hope and that is why you're not getting vaccinated, so we are just going to ban it. That is one. Then individuals who believe that they are protected from infection by taking ivermectin may choose not to get tested or seek medical care if they experience symptoms. doing so has a potential to spread the COVID-19 infection throughout the community. That is an interesting take on it. What they do not also talk about it is that when we ask the people to just stay home and wait for turning blue, that is also very dangerous for the person's life. Anyways, this is their first point. You can assess how strong or not strong this point is, how sciencey and medical is this point. Second point is the doses of ivermectin that are being advocated for use in unreliable social media posts and other sources of COVID-19 are significantly higher than those approved and found safe for scabies or parasite treatment. So, strange way of talking about the dose. Who looks at the social media post to understand the dose? But still, they think that it is unreliable. So, using this, I would consider usually social media to be unreliable. Nobody has said for any purpose social media itself should become reliable. It's more of a place for discourse and discussions. Uh, and then they just once again conflated another statement here, other sources of COVID-19. And so they just put them both in unreliable. And this is correct that there are adverse effects like nausea, vomiting, dizziness, neurological symptoms, um, which again they wrote dizziness once more. So you might have seen some um, TV programs where somebody is trying to bring out a list and says dizziness or something, and then says it again, and they say you already said that. So vomiting, dizziness, neurological effects such as dizziness, seizures, and coma. Uh, any drug given in incorrect doses can cause toxicity, and there are drugs which are over the counter can cause even death and are used by people for suicides. So again, this whole paragraph, I just don't know what they are. um, this again does not look like, this seems more like a reaction where they're trying to say that, hey, we don't think that you should use it, and the only information about it is on social media. We don't think that is reliable, so just don't use it. There are pharmacology books, there are researches, there are studies, there are a bunch of things, and I believe doctors and now even the general public is able to go find researches, figure out what is safety profile, figure out how to use it, and so on. Anyways, this is their second comment. Finally, there has been a 3 to 4 fold increased dispensing of ivermectin prescription in recent months, leading to national and local shortages for those who need the medicine for scabies and parasite infections. That's a sad thing to actually say, that just 3 4 fold increase of a drug has, and the drug like ivermectin, which is made so much in so many countries, and which is so cheap as well, and it is so prevalent in the world as well, it is made everywhere, and they're saying that 3 4 fold increase. It will be very interesting to see that what is the one fold. Was it 100,000 tablets a year, and now there are 3 or 4 or million tablets? What is it? What is the number that has caused shortages for scabies and parasitic infections? This, it just, in the US, remember in the beginning, US administration came out and said masks are not needed, and then they came back and they said masks are needed. And when they were asked that, why did you say that masks were not needed before, they said that because we thought there'll be a run on masks, we didn't have enough masks, and we wanted healthcare workers to continue to have masks. So we said, so I'm paraphrasing, something to that effect. This is a similar thing here. I can't imagine a government is actually just taking this as a reason to say we would not want someone to prescribe it. I am so naive that I thought everyone in the world, because we are all stuck in the pandemic, every one of us will be thinking and putting their heads together. looking at various possibilities and saying, how do we handle this? How do we take care of this? Oh, we found something. Let's work on it. And here we are. That it's just strange. So all medical practitioners can continue to prescribe oral ivermectin for approved indications. However, prescribing of oral ivermectin for indications that are not approved is now limited to certain specialists. So very, very interesting plus sad, because at the end of the day, any possibility of helping, may that be through anti-inflammatories. Imagine Oxford came back with the steroid study. Before the study, steroids were still needed. They were used in ICU. And they did the study and they came back and they said, somewhat useful. Imagine before that study, if there was a mandate to say, don't try to touch steroids because it is not approved. Anyway, so this is Australia. I want to share this as well. So one of the cool beans, who is a Patreon, shared this with me. If you see here, this is Vermont. So all the way from Australia now to US, my country. So Vermont here. So if you see here, emergency regulatory order to Vermont, and check the date here, 2 days ago, right? So it is 2 days ago. And here is the order. Although order, another cool bean pointed it out on Twitter that the order is actually April 10, 2020, because I was wondering, why is ivermectin not in this list? So check this out. So this is an older order. Sorry about this dizzying spell. Okay. This is an older order, but they somehow, I think, reminded everyone once more 2 days ago. What does the order say? The order says, emergency regulatory order to Vermont pharmacies and pharmacists. So this is to pharmacies and pharmacists. This is really saying to them that, number one, scrutinize more for the prescription, and if necessary, don't do it. And if you feel, report the doctor. Employ enhanced drug utilization review to curb inappropriate prescription. During a declared state of emergency in Vermont as a result of COVID-19, the Director of Professional Regulation and the Commissioner of Health may issue such orders governing regulated professional activities and practice as may be necessary to protect the public health. So they continue on and they are saying no legend drug is currently FDA approved. And what is it that they're saying? Here is the existing law. And then they're saying Board of Pharmacy Administrative Rule 10.30 requires that a pharmacist review the patient record and each prescription drug order presented for dispensing for the purpose of promoting therapeutic appropriateness. So this is their rule, pharmacy board's rule, that pharmacists should review what a doctor is prescribing and kind of figure out if it is promoting the wellness for the patient or not. Therapeutic appropriateness is there or is not. To identify, among other things, drug disease contraindications, incorrect drug dosage, or duration of drug treatment. This is fair to say that, hey, pharmacists, when you are going to give out a drug, make sure that there is no negative effect, there is no incorrect dosage, and so on. Then they say, and clinical abuse and misuse. And this is a very broad term, abuse and misuse. One could say that, hey, Tylenol's use for headache is a misuse, because, yeah, sure, it is a painkiller, but who said it is for headache only? Or who said it should be? Anyways, it's over the counter. Emergency regulatory order. For the foregoing, again, remember, this is April 2020. For the foregoing reasons and on the basis of the foregoing authority and findings, Vermont retail pharmacists and pharmacies shall, for any newly established outpatient prescription drug order for a drug known or popularly believed to be under investigation for COVID-19 indication, and specifically for these, apply enhanced drug utilization review. By requiring that, look at this, this is the pharmacist going to require. The prescription order includes documented diagnosis from the prescriber. The diagnosis and drug are plausibly within the scope of the prescriber's practice, if known. The drug is reasonably indicated for the diagnosis as indicated by FDA approval or support by credible literature, meaning literature upon which a reasonable professional competent in clinical pharmacology would rely, and the drug is not prescribed in a quantity manifestly in excess of the patient's anticipated need. Now, if I would look at this clause, I would argue that when somebody is looking at a research paper, and imagine it is peer reviewed, accepted, published research paper, in my opinion, that is enough of a credible literature. But again, this is just my interpretation. Maybe this is wrong. And so this is what they had done in April 10, and they put it back up here 2 days ago. Interestingly, it doesn't have ivermectin, and don't tell them. Then, next piece of news, Israel preparing. So this is September 12. So we are at September 23 now. Israel preparing for possible fourth COVID-19 vaccine dose. So I think it will be interesting for us to once again look at Israel's dashboard and see how the progress for vaccination. The last time we looked at the dashboard, it seemed like vaccines were protecting, but they have some reason to say, let's have the fourth dose. So we'll look into that in the coming days. And now the big one for today, Novavax. So number one, this link, all of these links are in the description. This link is to Novavax general updates. So it is interesting to see these updates. And then here, is my audio actually working? Okay, so it looks like audio is working. So I'm trying to prepare and become used to OBS and how it functions for going live on Odyssey. So this is just me training myself. So I probably sometimes get this jittery, that is the system working. Okay, so Novavax statement on proof of COVID-19 vaccine requirements for Prevent 19. So let's look at that. So this is one page here, various news. Here is the interesting Novavax statement on proof of COVID-19 vaccine requirements for Prevent 19 clinical trials. Check this out. It's actually very good. They do give a disclaimer that this particular news does not mean that the vaccine has given emergency use authorization, have been given, or has gotten authorization. They're simply saying they're sharing an interesting piece of news with you, and that is September 17. They're saying the US Center for Disease Control and Prevention recently provided updated guidance stating that participants in the Novavax Prevent 19 phase 3 clinical trial meet the criteria to be considered fully vaccinated 2 weeks after they have completed the vaccine series. So this is a good news. It is not emergency use authorization. This is not authorization at all. This is not approval to start using Novavax. They still need to get the EUA, but this is a good sign that the CDC is saying, hey, the participants of your vaccine can be now considered fully vaccinated if after 2 weeks of the series. With this validation from the United States leading public health authority, Novavax expects our Prevent 19 phase 3 clinical trial participants will be considered fully vaccinated and in compliance with mandated vaccination policies, including those of employers and any other organizations or entities requiring proof of vaccination. Then they say, this is the disclaimer, Novavax is preparing to submit NVX, their vaccine, our protein-based COVID-19 vaccine, to the US Food and Drug Administration, FDA, for emergency use authorization. The CDC guidance does not imply that the vaccine has been approved or authorized by FDA or is recommended by CDC or ACIP. So they're saying not approved yet. We are preparing to get it to an EUA, but here is a very encouraging news, and I agree, this is a very encouraging news. Continuing. Novavax to participate in University of Oxford COM-COV-3 study comparing mixed COVID-19 vaccine schedule in adolescents. This is also another very interesting news. This is September 16, that Novavax will work with Oxford for mixing and matching vaccines and seeing their effect. Remember, they had been, this is UK, love UK's continuous groundbreaking. I'm not a big fan of not allowing ivermectin like management over there, but still love it how they're collecting data, how they're doing the studies, how they're being bold with vaccine mixing and their vaccine windows and so on. So here, Oxford is running a study where they are going to mix Novavax in the other vaccine schedules, and that will be interesting. Then I think once again you are aware of this even before me. I'm just being on the same page with you. Novavax statement on Takeda agreement to provide 150 million doses of NVX-CoV2373 to the government of Japan. This is beautiful. So this is September 10. Takeda Pharmaceutical Company Limited announced on September 7, 2021 that it had finalized an agreement with the government of Japan's Ministry of Health, Labor and Welfare for the purchase of 150 million doses of Novavax recombinant nanoparticle COVID-19 vaccine candidate for Japan. So this is a great news. I love it. So there is a ray of light for Novavax. I was of the opinion that Novavax is not going to get approved in the US because there are already enough vaccine types and vaccines, and they are already not being taken a lot. Why would US say, hey, let's have another vaccine? But it may be that they may get EUA as well, because it doesn't seem like in another 6 months or another year, the vaccine need is going to go away. It looks like these boosters and continuous vaccines would be needed. So I think US might actually approve this as well. So I may have been wrong. Novavax to participate in Octave dose study to evaluate third dose of vaccine in participants with impaired immune system. This is also another very interesting story. It is August 25th. But what they're saying is they've been giving people 2 doses, but those who are immune impaired, they're going to give them a third dose to study that as well. So they are already going to study booster as part of their overall trialing sequences. So that's a very interesting news as well. Look at this. Funded by the UK government's vaccine task force and UK research and innovation, this study is being led by the University of Glasgow, University of Birmingham. It is followed on to Octave and so on. So very interesting. Continuing. One more. Novavax announces COVID-19 vaccine booster data demonstrating 4-fold increase in neutralizing antibody levels versus peak responses after primary vaccination. So we have talked about this before as well. So they've given the primary vaccine, that is 2 vaccine doses, and then they came back with a booster, and they're saying, hey, when the booster is given, the antibody levels go up 4 times. And we have done this discussion that it really depends when is that booster given, and if this immune system is already trained, it's going to become revved up. So not a bad thing. So today is all Novavax news day. And then Novavax and Serum Institute of India announced submission to regulatory agencies in India, Indonesia, Philippines for emergency use authorization of Novavax recombinant nanoparticle COVID-19 vaccine. So Novavax is not just waiting for the US, they are working globally to try to figure out what to do and how to move forward. And I think that they're doing good. So this is the set of news. There were a bunch of other news as well, but I thought let's look at this today. tell me this, is this something that we should look at from a news point of view? I'm going to go back here to my main. So here we are. So hopefully this is interesting for you. Let's do a quick chit chat. I have a meeting today, so let's go till 7, so half an hour, and then I would beg leave. I have a call to make. So let's see. So Lynn says, will Novavax require a booster? I don't think that they would require a booster, but at least they have already tested it. So that means they're clearly thinking about it. Susan says, can't talk. I've banished myself to my room in my blanket fort. I hope you're doing well. Stacy, you are very welcome. All right, so let's let's break this one for now, and I'm going to come back for a chit chat, half an hour, and then I would beg leave. And please remember, for tomorrow we'll do a Zoom call. I will place the Zoom link on Discord, here on YouTube, and on Patreon. So thank you very much. Please do me a favor. If you like this work, please like, subscribe, and share. I can guarantee you that those who are not liking it, they are not leaving any stone unturned to report it, to complain about it, and to bring it down. I am at this time under attack. My business is under attack. My work here is under attack, and I, as a my personal career, is under attack as well. There are complaints all over the place. Every day there is a new thing. Yesterday we had a new audit. Anyways, that's just that. Please do me a favor, like, subscribe, and share. And if you would like to support this work, you can buy me a coffee and support me that way, or you can use PayPal, or you can become a patron. So thank you very much. I am a strong believer in healthcare students, healthcare workers, education, clarity of concepts, so that when they are treating a patient, when there is no book besides them, when it is all them and the patient, these clear concepts would help them apply better, do better practice, do better doctoring, do better medicine. So your help in this is welcome, and thank you very much. I'll see you in a few minutes.